Welcome back, everybody. This Week in America on the Blue Funk Broadcasting Radio Network. Great to have you with us on the program. As mentioned, our guest is Dr. Barry Lycka, one of North America's foremost authorities on cosmetic surgery, skin cancer surgery, reconstructive surgery, and laser surgery of the skin. He operates an approved non-hospital surgical facility in Edmonton, Canada, a member of the esteemed American Society of Surgical Professionals. He's the author of the new book, Don't Choose a Cosmetic Surgeon Without Me, Your Complete Guide to Finding the Perfect Cosmetic Doctor. Dr. Lycka, welcome to This Week in America. Great to have you with us on the program.
Well, thank you for having me, Rick. It really is my pleasure for being here.
Well, it's great to have you on the program. This is something that you read the numbers each year, and more people are thinking about it and actually going through finding someone and getting some procedures done. Let's first of all talk about some of the popular procedures that people are getting done, and then we'll talk about the basis of the book, which is if you're thinking about a cosmetic surgeon, read the book. I'm going to tell you exactly how to find one. But first of all, what are some of the popular procedures now?
You know, there's so many out there. It's very, very common to get some cosmetic surgery done. I think it's best to break them down into non-invasive and invasive procedures. Non-invasive procedures consist of things like Botox, getting fillers put into the face, getting things like laser hair removal, getting things like lifters to the skin like Ulthera or Thermage. So those are very, very popular non-invasive procedures. And by that, I mean there's really not much downtime. There's really not much surgery involved. They are procedures that people get done by the thousands, millions every year. And that's why they're the most popular procedures. There's no downtime, yet they work. Now, as far as surgical procedures, it all depends which list you go through. Some people will go through and say the number one thing that people get done is breast implants. But others would say it's either liposuction or eyelid procedures, such as a blepharoplasty, which means an eye lift procedure, or even nose surgery called a rhinoplasty rates high on the list. So it depends which list you go through, who's making the list. But over and above all, Botox is the number one procedure done in the world today.
Dr. Barry Lycka is our guest on the program. His website is Barry Lycka, and that's spelled LYCKAMD.com. All that information available at our website. And the book is Don't Choose a Cosmetic Surgeon Without Me, Your Complete Guide to Finding the Perfect Cosmetic Doctor. All that information at our website. The book's available at Amazon as well. You list trends in the book, and it's interesting. We talked about some of those, but the one thing that's really sort of jumped out at me in the beginning is less is more. This overdone look that we saw for so long, and we see even now when we go to the grocery store and we look at stars on the covers of the tabloids, less is more, really a more natural look is obviously one of the major trends.
You know, and I pointed out several of the trends in the book, and this is one of the major trends that I've noticed. Most people want to get cosmetic surgery done. Most people don't want to look like they've had cosmetic surgery done.
Yes.
So they really want to look natural. Natural is the way to go right now, Rick. And that's what people should look for. So that means we're doing things in such a way that we're trying to make a difference, but not make them look overdone. It used to be 20, 30 years ago that people would get a facelift done, and they'd hide away for 12 weeks after something like that. Now, that's not done very commonly now. Even when a facelift is done, a person's out of commission maybe for a week or two. So most people are looking at a more natural way of getting things done. That means we're doing more minimally invasive procedures, but we're combining those minimally invasive procedures to get a better result.
The book is called Don't Choose a Cosmetic Surgeon Without Me, Your Complete Guide to Finding the Perfect Cosmetic Doctor. It gives you great insight into what makes a good cosmetic surgeon and how to find one. And let's start in talking about that and looking for a cosmetic surgeon. So many times the procedures we're talking about not covered by insurance, so it's out of pocket. So we figured that we're going to be a frugal a customer. We're going to go look and we're going to get a deal. And you say, red flag, don't do that. You know, that certainly should enter into the equation, but that's not the primary way you look for a doctor.
Yes, I mean, you're dealing with your body here, and the body is the most important thing here. I don't know how many people would think there's something wrong if I offered him a Mercedes Benz for $1. You know, I think there was something wrong with this picture. You can't do that with cosmetic surgery either, because a good cosmetic doctor takes years of training. He has a very good staff. He's always developing his skills and abilities. So you can't expect to get a real good bargain here. you really should be looking at what I call good value, whether you're going to get the results that you want. And that seems to me more important than getting a dollar price.
There are two things that come out as you read the book, Don't Choose a Cosmetic Surgeon Without Me, Your Complete Guide to Finding the Perfect Cosmetic Doctor. Our guest in the program, Dr. Barry Lycka, his website, Lycka, LYCKA.com. Listen and trust. Let's first of all talk about that listen aspect. I understand when we're talking to a doctor, we should be talking to a doctor and he should be listening to assess exactly what it is we want the finished product to be.
Yeah, as I say, when a person goes to see a cosmetic doctor, they really have to get a communication going. They have to discuss things with the doctor. The doctor has to offer the procedures that they want and has to be listening to what really bothers them. If they're not, you really should think about going elsewhere because listening and talking are two of the very fundamental skills. The very best cosmetic doctors that I know are great listeners. They communicate well, and that is very important.
What should we be asking? We're sitting there, we're talking about ourselves, the doctor's asking us some questions. What are the specific questions we should ask a doctor?
It's really, really difficult to go into a doctor's office and you're overwhelmed in that sort of situation. So you should bring a list with you. And one of the things that I put together in my book is what I call the doctor index. It's right at the back of the book. And in that, I give you the questions to ask. I show you exactly what you need to look for when you go to that cosmetic doctor's office. So that doctor's index, I think, is worth the price of the book alone. But there's so much more in there. I think people should just look at the book, see if it's for them, and pick up a copy today.
And it's interesting too because you've got scorecards in there. So we have things that we need to ask, things that we need to assess about the doctor, give them a score, and this is going to help in our evaluation of whether or not we want this particular person to be our surgeon.
Absolutely. It's so hard to really evaluate somebody without the tools that you need. I've given you the tools so that you can do this reproducibly. Everybody can do this. It's really simple.
The book is called very simply, Don't Choose a Cosmetic Surgeon Without Me. I love the title, Your Complete Guide to Finding the Perfect Cosmetic Doctor. Available at Amazon, the doctor's website, which is Barry Lycka, LYCKAMD.com. Information at our website, thisweekinamerica.us. As part of the book, too, you also have conversations with some of the best cosmetic surgeons, as well as a chapter where you're talking to patients and getting some of their input. That really, when you read that, gives you great insight as to what are the skills we need to look for in a doctor, but what other people are looking for and how we can relate directly to them because they're in a position just like we are. They're starting from scratch, going in and looking for someone to perform a procedure.
Yeah, when I started this book, I didn't want this to be an egghead book of some academic telling you what you should do. I wanted this to come from the heart. So I interviewed the doctors that are doing the best cosmetic surgery. So there's a bunch of information in there. But I've also interviewed the patients who are getting the cosmetic surgery done. And they tell you what to look for in a cosmetic doctor. They tell you what's the best thing to look for. I think that's very important.
You talk about, which I found interesting, the disease of the zeros. And we all hit that as we hit the 30, we hit the 40, we hit the 50, and we're thinking this is sagging a little bit. We need to do something with this. It's really something we all go through. And you're saying now it's never too late to get started. Actually, with the procedures now, we can turn this around very quickly.
Absolutely. I talk about the zeros and I say about that laughingly because all of us go through the crisis of the big 4-0, the big 5-0, or crises in our life. Now, those are times where we really should rejoice because now we can roll back the clock at those times. Use these times as a way to get ahead, not behind.
You're listening to This Week in America, our website, thisweekinamerica.us. Our guest on the program, Dr. Barry Lycka. Don't choose a cosmetic surgeon without me. He's the author of that book, Your Complete Guide to Finding the Perfect Cosmetic Doctor. It's available at Amazon, at our website, thisweekinamerica.us. In the book, you also talk about, and you really don't think about this, I want this procedure, but the number of decisions you're going to have to make as you go through the process. It's not just as simple as walking in and saying, I want my breast fixed.
You have to first decide when you're doing this of what you don't like. I mean, if you don't like your breasts, you really should think about what is it that you don't like about them. Are they falling? Are they flabby? Have they lost some of their natural texture? Have they done some things that you just don't want anymore? Because all those things will help guide a doctor into choosing what he needs to do to improve your breasts. And believe me, there's a lot of different breast procedures. There's breast augmentations, there's breast lifts, there's breast augmentation using fat. So each procedure has a different audience to be used on. Very important to realize that.
Is it important when I'm deciding, okay, I want this procedure, I'm comfortable with this doctor, but he's not performed a lot of these procedures? Should we try to find a doctor that really is proficient in that type of procedure that we're looking for?
I always think you should look for the best person in your category that should be doing that surgery for you. That means a person that's well trained, that's knowledgeable, that writes about the procedure, and also educates other doctors about the procedure. Because each one of these is very, very important. If you're not looking for the best, I think you could get the worst.
What's the difference between cosmetic surgery and plastic surgery?
Plastic surgeons go through their own schools, they go through their own way of training. Many other doctors are cosmetic doctors, like myself, who have gone through other schools of training. I'm a dermatologist, so I'm a cosmetic doctor that's trained through the dermatology schools rather than the plastic surgery schools. Now, there are excellent doctors in each of those categories. There are excellent doctors that bring things to the table. So you should really look at all of them when you're looking for a cosmetic procedure.
What is the relationship between the doctor and the patient? You write in the book, you try to think of your patients as members of the family. Do most
Yeah.
doctors have that attitude that this is not just somebody that's coming through, they'll be gone in 6 weeks and I won't be dealing with them again? It sounds like your relationship is much closer.
I think that every good cosmetic doctor that I know of has a relationship with their patients that transcends the procedure. It goes on much longer than that. And the doctor has a fiduciary trust for the patient. They'll only do what's absolutely right for the patient and nothing else.
Is it difficult sometimes when someone comes in and they have really unrealistic expectations? I mean, this is who you are. We can make some modifications. We can't totally make a major change.
I always emphasize to patients that they must be realistic, that they bring in a picture of some gorgeous movie star, that they're not going to get that way. I think I try to lower people's expectations to the point that I can achieve them, and I'm usually much more successful that way.
Dr. Barry Lycka is our guest on the program. Don't choose a cosmetic surgeon without me. Your complete guide to finding the perfect cosmetic doctor is the doctor's book. It's available at Amazon, available at his website, which is barrylyckamd.com. Lycka is Lycka. All that information, of course, available at our website, thisweekinamerica.us. You read from time to time about more young people getting involved in cosmetic surgery, and we sort of live, I guess, in maybe an airbrush society where we see pictures of people. That's not really how they actually look. That's how they end up looking when they go through the process. Is this a concern of yours that maybe too many young people are attempting to have things done that they really don't need to have done?
Yes, and I think young people should think quite hard before they get any cosmetic procedures done. And by young people, I mean teenagers really are not fully developed yet. They're certainly not mentally developed to the point that a lot of these procedures should be done. In fact, the American Society of Plastic Surgeons puts guidelines down as to who should be operated on. And I think those guidelines are conservative, but they're also excellent for people to follow.
Couple minutes left in the program. I want to ask when people go and they're talking to the doctor, and again, most of the time this is out of pocket, and the doctor is saying, "Here's what this is going to cost." Are there questions we should ask when we get a price? I mean, are there upsells involved in the way along the way? Are there different other procedures that the doctor may try to sell you and add on to that? How do we know that cost we're getting is actually the final cost? It's going to take me from the beginning to the end, pay for it in full.
I think a good doctor will evaluate all the costs and come up with a cost for everybody. In other words, they won't be trying to upsell once the cost is done. I think upselling should be should be frowned upon in our profession. And it's the sort of thing when you go get your carpet cleaned and there's 10,000 other add-ons on top of that. I think in the medical profession, that's something that should never be done. So the full price should be discussed up front and a priori.
I talked a few minutes ago in the program about listen and trust, two words that really jump out as you're reading the book. Don't choose a cosmetic surgeon without me. We talked about the listening aspect. How about the trust? Is that like the final one? I'm going to sign off on this doctor because I really feel comfortable turning my body, and that's what you're doing, turning my body over to this doctor.
I think every doctor that is very much a good cosmetic doctor will be basing his reputation totally on trust. He does the things, he develops the procedures, he helps to make the procedures what they are. And so a good doctor will only be based on trust. Trust is the number one relationship in a doctor-patient relationship, and it's something that most good doctors will develop. In fact, all of them will develop. That to me is the paramount thing in any doctor-patient relationship.
A great segment in the book as well, chapter on different myths, some of the things that we think are true that are not true, and the doctor goes through and addresses those. It's very comprehensive. It takes you all the way from beginning to end. You mentioned at the end of the book the doctor index, the pointed questions that you should be asking, the scorecard. It walks you all the way through, and the book is called Don't Choose a Cosmetic Surgeon Without Me, Your Complete Guide to Finding the Perfect Cosmetic Doctor. Our guest on the program has been Dr. Barry Lycka. That's Lycka. The website for the book is Barry Lycka, LYCKAMD.com. Of course, available at Amazon. And of course, as always, all that information at our website, thisweekinamerica.us. Dr. Lycka, thank you for joining us on the program. Look forward to having you back. An excellent job on the book. Don't choose a cosmetic surgeon without me. It's like, stop. I want to be your friend. I want to be there with you when you're making that decision. I love the title of the book. Thank you for joining us on the program.
Thank you, Rick. It really was my pleasure to be here today.
You're listening to This Week in America on the Blue Funk Broadcasting Radio Network.